Hi everyone, I'm Tammy Kohlschmidt of Thermography for Health New York, and I'm excited to be here today with Dr. Jake Shettell.
That's right.
He is a naturopathic doctor. The reason I have him here is because he specializes in breast health, among other things. So he is the newest member to our team. So when I was reading your bio, I found it very interesting that you actually have experience at clinics with breast health. So tell me a little bit about that world and what you saw and how you got yourself really interested in breast health.
Okay. So I had a clinic rotation with Dr. Heather Paulson at the Naturopathic college that I talked about. And most of the patients that we saw in that clinical rotation were breast cancer patients.
That's great. Then that's
And
you have a lot of experience with that.
And so seeing those patients and seeing how encouraged they were by integrative care and not just going down the path of what the oncologists say goes, but trying to move forward with the best treatment options available and integrating both worlds, both the natural and kind of the conventional therapies.
Yeah, which
so
you kind of have to.
Right.
Right. They
well,
need each
especially
other.
the further you are in the breast cancer world, the crazier the diagnosis, the more intervention sometimes that needs to take place.
Yeah.
But seeing how women were encouraged by the therapies that we were doing in that setting, and the education that we were providing them, and to see them kind of be able to take that deep breath of relief and say, okay, especially the new patients that we were seeing for the first time, to take that deep breath and say there's a lot of hope and I don't need to worry about this too much.
Right, light at the end of the tunnel.
Light at the end of the tunnel, yeah. And so it's important to take those steps necessary in both the conventional model and the naturopathic model to make sure that you're doing the most
everything
you can. Everything you can. And that usually empowers women, knowing that I'm doing everything I can.
Yeah.
And that's awesome, and that's okay.
So this experience in this clinic, is this what prompted you to do your risk assessment?
Yeah, so I had the experience on that clinic, and then I opted in for that second, another round in that same scenario. So I took that clinical rotation twice.
Again, yeah, good.
Which was nice. Saw a lot of women with breast cancer. That was very helpful. And then what actually ended up happening was I got into clinical practice. This was in Arizona. Got into clinical practice. Was doing a lot with like pain management. I was using acupuncture as a modality quite frequently.
That's cool.
But then I had a phone call from a relative who asked me what my opinion was if she should go forward with breast cancer screening. Her mom had breast cancer, and so their primary care physician was prompting my relative to start getting a yearly mammogram. And she said, should I do that or should I not? And so I said, you know what? Usually in the clinic, my only experience with this is we just recommend what the United States Preventative Service Task Force recommends, or some of the other institutional bodies, which is either yearly screening starting at age 50 or biennial screening, doing it once every 2 years starting at age 50, or some institutions recommend even starting at age 45 or as early as 40 or 10 years before your mother had breast cancer or sister. And so I didn't know how to answer the question. She asked me, and I didn't know. And I felt a little out of place. I said, this is usually what we do. We just give this kind of guideline. But hold on, let me look further into this and see if I can figure something out.
Wade through the waters, because there's so much information.
I waited so much. My wife was on a trip, so I had a whole week. My clinic was fairly new, so I wasn't seeing a ton of patients, so I had time to research. And that week, I can remember pulling 3 all-nighters. And that week, just because I was so, I guess, captivated by all the data that's out there. A lot of research has been done on breast cancer.
Yeah.
And so, and especially with screening mammograms. And so I looked into the screening mammogram world, and to make a huge long story short, I came to the conclusion along with several authors of various published studies in peer-reviewed journals that say that one-size-fit-all approach doesn't work.
It doesn't work.
Yeah, it's meant to be thrown out there for the whole population. Like, let's just do screening mammograms in this way.
Yeah.
And when that got popular in the 80s and, well, especially 90s, breast cancer mortality only slightly decreased, but that was probably due to just better therapies overall, not necessarily due to the breast screening mammograms. And so I looked into that whole world, and just research study after research study, meta-analysis after meta-analysis, review after review.
Bless you.
Blah, blah, blah.
Go through all of that.
I liked it. For some reason, I liked it.
Yeah, well, you're a doctor.
Yeah.
That's what...
And I had to relearn a lot of statistical things like positive predictive value, negative predictive value, how to come up with those, what's, the sensitivity and specificity of a test, in this case mammograms. And at the end of the tunnel, when I emerged, I'm still highly into all the research, but what came of it was that you have to individualize breast cancer screening. Mm-hmm. It's good to get a mammogram if you feel like a crazy lump or something, but the idea of every woman should get screened for breast cancer can be problematic because of something called overdiagnosis and overtreatment, and that's where you treat a breast cancer tumor when in fact there is a breast cancer tumor, but it would have never caused an issue in that woman. Correct. But in the clinical setting, because we can't tell if a certain tumor is going to
what's it going to do?
Not do anything her whole life, if it's going to spontaneously regress, or if it's just going to stay small her whole life, we don't know. And so the conventional medicine always errs on the side of caution and says, we should take care of this. Chemo, radiation,
everything
surgery.
is a fear factor, all of it.
Right.
Yeah.
And, and that does help some women, it really does.
Yeah.
But a lot of times it can hurt women. And surveys have shown that when women are given the full truth of what the benefits are of breast cancer screening through mammograms and what the risks are, between 50 and 70% opt not to get screening mammograms.
Right.
Because they've been educated to a point where they feel comfortable making a decision. Yeah.
And thermography, coupled with ultrasound, if you want that anatomical view, can give you an amazing array of information.
Yeah, especially if you repeat it,
things.
Right?
Yes.
Because you have something to
it's
to
looking
go
at
off
the function of the physiology, inflammation, and then of course if you do the ultrasound, you get some anatomical information. So put those together, you've got a good amount of information to figure out what you're going to do next.
Right.
So the breast health assessment that you came up with then is based on, how is your breast health assessment different from anyone else's? How did
let me
this come
back up just a little bit with that story. So my relative's asking what she should do.
Yeah.
So I do all this research. I find out that there's not a one-size-fits-all.
Right.
And that the best thing is just educate benefits and risks, and then together make a decision with the patient or client. And so, but I was still, that still wasn't enough for me.
You need to know a lot.
Just whether somebody should get screening mammograms or not, there's got to be more that we can do. And obviously, from a naturopathic perspective, there is. And so, so that led me down the research path of what are all the therapies out there, natural therapies over the toxic, tamoxifen or raloxifene or other chemotherapeutic agents. What else is there that we can do in a preventative standpoint, or even in a scenario of breast cancer? What can we do to support the body?
Right.
Using the 6 principles of naturopathic medicine, using something that we call a naturopathic therapeutic order. What else can we do? And so that led me down the research that there is on natural therapies. And there's actually quite a bit that's been done in the research. I mean, there's definitely a need for more, and hopefully we'll get more and more trials with bigger and bigger numbers of women enrolling in these trials.
Yeah.
But the small trials that we have, they're pretty promising. And it almost seems like there's also like a synergistic effect where if you go at prevention in multiple different directions, or even if there's a confirmed case of breast cancer, if you support the body in multiple ways, then it seems to almost act synergistically, and so that the patient will either respond better to the radiotherapy, will have less side effects from the radiotherapy or the chemotherapy, or their tumor size will shrink before the surgery or before the radiation or whatever is done. And a lot of those natural treatments are herbs. They're herbs. In some cases, they're different extracts, usually botanical extracts. It's lifestyle modification. It's healthy living. It's essential oils even. There's some interesting data on essential oils. That needs to be more done in clinical trials, but at least like in cell cultures, if you put some boswellia or some frankincense on the cells, at least in a petri dish, they respond magnificently well.
Apoptosis.
They
die.
They die. The cancer cells die, and the normal cells stay alive.
They thrive.
And so there's a lot we can do naturopathically to address both the preventative and in confirmed cases of breast cancer.
So that's exciting to me, which is why I was really looking forward to having you here, because I wanted you to get it. I wanted, in your words, for that to come out. Because I have been telling women about you. I think everyone needs a naturopathic doctor as well as an MD.
Wouldn't that be great? Yeah.
Because now you have two people coming from different worlds looking at the patient differently. And collecting all of that data is how you can make your best treatment. You can marry the two worlds.
Right. Bring the paradigms together and see what can happen. And what can happen is usually magical.
Exactly.